Test hip extension. All right, so for this, I'm going to use my stabilizing hand, either hand, if you're left or right, on kind of the base of his spine, kind of right above the bottom. And then as I have him, maybe if you can, get off your elbows so you're a little more flat. I'm going to say the same thing. Can you please lift your leg towards the sky while keeping your knee straight? And as he does that, I'm going to push down on the back of his hamstrings. And he's a 5 out of 5. So I'll push down, pretty firmly as long as there's no reason I shouldn't. That's manual muscle testing for hip extension. The other 3 are done in tall sitting, which is sitting with your feet dangling off the edge. I'm going to test that leg. We tested this leg. We'll keep it left leg in hip flexion. This is seated at the edge of the bed. In this case, I'm going to keep one hand on his other thigh. My other hand is going to be pushing down kind of right above his knee pushing down towards the ground. Can you please flex your knee? I'm going to push, 4 out of 5. That's the left hip that I'm testing. I meant to say flex your hip, not flex your knee. And then internal and external rotation, pretty simple. You're just going to take that side. You're going to put your stabilizing hand right above the knee. Can you internally rotate, meaning bring that to that side? Sorry, you can move around if it's easier to see. All right. So I'm going to put my stabilizing hand above the knee, and I did that backwards. And then pull against the motion that he's doing this in. So if he is internally rotating, I'm pulling him into external rotation with my stabilizing hand there. Then we're going to do the opposite, and I'll do it this way. You can get on the other side too to kind of give some counter pressure. Either way, my hand is stabilizing right above his knee and pulling in the opposite direction that I'm having him move in.